What is mental illness? Mental illness, according to the Mayo Clinic, refers to a wide range of mental health conditions. These conditions affect your mood, your thought process, and your behavior. A few examples of mental illness include depression, anxiety disorders, schizophrenia, bipolar disorders, eating disorders, and addictive behaviors. According to the American Psychiatric Association, nearly 1 in 5 U.S. adults experience some form of mental illness. 1 in 24 has a serious mental illness, and 1 in 12 has a substance use disorder. Think about how much that can affect someone's life if they have no access to resources, or they are unaware of their resources, or not willing to ask for help. A few of the causes of mental illness, according to the RC Psych, is that they are a combination of genetic, biological, psychological, and environmental factors. They have nothing to do with any personal weaknesses or character defects. They're simply caused by these factors. Another factor may be stress resulting from any social, work, or family activities. These activities can include divorces. They can also include a traumatic experience that you might have had that is now stressing you out and you're unable to live your life normally as you would. Some of the treatments, according to the American Psychiatric Association, are based upon individualized plans that are developed collaboratively with the mental health clinician and an individual. The family members are invited if the individual desires, but these treatments include psychotherapy, which is talk therapy. When you do psychotherapy, there is a broad amount of ways that you can resolve your problems. There are so many studies and so many different therapies, treatments that can really help you. For instance, there is the cognitive behavioral therapy, and I have a small model of an example of that, and it's the cognitive model. And it basically is a way that teaches us how to better control our thoughts to maybe reduce our anxiety levels or maybe even depression levels. So here we have a situation that cannot be changed. So it's something that occurs. Then we have a thought, which is the way that the situation is interpreted. Then we have an emotion, which is the feeling that occurs as the result of the thought. And then we have a behavior, which is the action in response to that emotion. So really, when we have a negative situation or something bad that happens, we tend to have automatic, negative, unrealistic thoughts, which then lead to feelings of guilt, unworthiness, depression, or depressed moods. Then that leads to a pretty negative behavior, which could be treating others unkindly or even treating ourselves unkindly. So as we break these down, we realize that really we have the power to change a thought. When a negative thought comes into our mind, we can challenge the thought and think, how realistic is it? How positive is it? As soon as we do that, we can bring a positive and more realistic thought into our minds, and that immediately will have more of an effect on our emotion and behavior. So that's just a small example of how talk therapy is used to help individuals cope and live their lives in a way where they can challenge their thoughts and work towards eliminating their anxiety. Another way that is very popular, another treatment that's very popular, is medication. Oftentimes it is told that when you combine therapy and medication, it is to be more effective. Again, remember that it is an individual plan that you and your mental health clinician get to decide on, depending on how severe and how much you feel you need treatment. As far as what we can do, I think it's important to stop and think and understand mental health. It's important to realize how important mental health. It's just like physical health. It's important that our emotions and our mental health are always placed at a high standard. It's just like our physical health. If we don't feel good physically, we can't perform tasks the same way. Secondly, it's important to know our resources. There are so many resources that are available to us. No matter what your financial situation is, there are resources that may be state funded or people may volunteer. There's ways to get help. You must be willing to get help, and invite others to get help if you feel they need it. It's okay to ask for help. In the times that we live today, we most of the time don't want to ask for help and we want to take everything on ourselves. But again, when you're sick, you will need a doctor, and mental health is important. So I encourage you to please share this information with someone you think may need it, or maybe if a family member you know is needing it. It's okay to talk about it. Mental health is important and it should be talked about, and we need to be more aware of it.